morning, folks. This is the convening of the Central District Health Board meeting for January 15th, Friday. It's 2021. It's 8:30 in the morning. I am Betty Ann Nettleton, one of the Elmore County representatives, and I will call the meeting to order. Start with roll call with Ada County. Dr. Young, are you there?
Jane Young here.
Dr. Epperly?
Madam Chair, this is Russ.
Okay, Russ, go ahead.
Yeah, I just wanted to let you know that Dr. Epperly had another commitment at the time we set up this meeting. As you know, we typically don't meet in January, so this meeting was scheduled over top of one that he already had that he wasn't able to reschedule. He did tell me he would try to join periodically as he's available, so we'll see if that happens or not.
Okay. Okay, thank you, Russ. Boise County.
Commissioner Sturm here.
Okay, Elmore County. Valley County.
Commissioner Hasbrook here.
Okay, did we just have somebody join the call?
Madam Chair, Representative Blanksma just did join us, so she's signing in right now, so she'll be part of the meeting.
Okay, thank you so much. So we do have a quorum present, and we will proceed with the meeting. Action items, number 3, it changes to the agenda. Russ, do we have any changes to our agenda?
Madam Chair, no changes to the agenda.
Okay, thank you. Proceeding on with new business, we need approval and a motion for the minutes of our December 18th board meeting. Are there any corrections or additions?
Madam Chair?
Yes, go ahead. Is this Megan?
Yes. Motion to approve the minutes.
Okay, thank you, Megan. Welcome. The motion has been made for approval of the December 18th minutes. Do I have a second?
Second. This is Jane Young.
Okay, thank you, Jane. All in favor? By county, I will take Ada County.
Jane Young, aye.
Dr. Epperly, I don't believe is on the call. Boise County, Commissioner Sturm.
Commissioner Sturm, aye.
Okay, Elmore County, Representative Blanksma.
Representative Blanksma, aye.
Valley County, Commissioner Hasbrook.
Commissioner Hasbrook, aye.
Okay, thank you, folks. Those minutes do stand approved for that December 18th meeting. Proceeding on with our financial reports by Laurel McMahon, our Support Services Division Administrator. So, good morning, Laurel, and welcome. The floor is yours.
Good morning, Madam Chair. Thank you. We'll go ahead and get into the budget to actual report. The screen that you can see right now is page 1 of the report, and this report goes through December 31st, so it's exactly 50% of the year. So in our revenue section, any numbers that you see above the 50%, which is just about all of them, represent that we're ahead of where we expected to be at this point in the year. So the overall summary for the report, page 1 shows that revenues overall are high at 66% of budget, and expenditures are on target as well. We're at 55% there. As a reminder, revenues and expenditures continue to be impacted by COVID funding. And the places you can see that the most on this report are in the contract section under revenues and in variance from the plan and personnel under the expenditures. Getting into a little bit more detail on page 1, under revenues, we'll just go line by line there. The other revenue for support services, that's higher than planned. That was due to some Idaho Power rebates, auction revenue, and auto sale that showed up on the last couple of reports as well. But just a reminder why that's much higher than planned. Under community and environmental health, you can see that our fees are high there. That's due to annual food inspection permit renewals. And when those came in, that was also on last month's report and continues to show the same this month. Our contracts are high under CDH due to our COVID funding. That's again where you can see that increase. And then the other section is high due to our Western Idaho Community Health Collaboration contract that we have there. Under family and clinic services, the fees and contracts are close to the planned amount. There is some variance, and fees are slightly lower than where we expected to be at this time of year. And that's because we haven't been able to offer all the same clinical services that we normally would during a non-pandemic year. The other revenue is high there, and that includes our home visitation funding. And then total revenue is slightly on target or a little bit above. Going into the expenditures section of the first page, under administration, you can see that personnel and operating are lower than planned, and that's because time is being charged to COVID funding rather than the planned PCAs. Under support services, personnel and operations, it's the same thing as for administration, lower than planned due to our COVID response. Capital is high there because of a project payment carried over from the last fiscal year, and that has been the same on the last several reports as well, but just a reminder as to why it appears so much higher. Under community and environmental health, the personnel and operating are higher than planned because of additional staff resources. That's also related to COVID. And then under family and clinic services, the personnel and operating are a little bit lower than planned. And that's because, again, we haven't been able to operate those services quite the same during COVID. And I will move on to page 2. This shows a little bit more detail and a comparison of the past couple of years. As you can see, both community and environmental health and family and clinic services are continuing to grow. As you can see from the numbers up on the screen, our CDH is $230,000 about above where it was at this point during the last fiscal year. And for family and clinic services, we're about $59,000 above where we were at this point last year. And that's even having reduced some of the services available during the pandemic. So that's great growth there. And then a reminder on the growth of fees for family and clinic services is that we did readjust some of our billing codes for better accuracy. We've also been working at collecting old account balances and improved there, so some of those numbers have increased as well. And then overall, between community environmental health and family and clinic services, we're $289,000 above where we were in December of 2019. So great growth there. Moving on to page 3, the cash balance statement. This shows a total balance of over $3.5 million. When you reduce it by the reserve fund designation, that leaves a balance of just over $1.2 million. And as a reminder here, at this point in the year, the amount typically goes down until we receive the second half of our state appropriation in January. And just as a note, in December when I provided this budget update, the number was actually a little bit lower, but we corrected it due to a formula adjustment. So you see a little bit of a change there. And then moving on to page 4. And this final page is exactly the same as it was during the December budget update. There has been no change here. It shows the projects that were included in the reserve fund designation and funded with carryover funds from last year. The only item of note on this page is that the final item on this list, the reception lighting revision, has been completed. I'm still awaiting an invoice on that. And then for the completion of the new carpet, paint, and furniture, right now our facility is at full capacity in terms of where we have people in the building. So we're waiting on some available space to finish up that project, but we still have the funds designated for it. Okay, and then there's one more financial report that we have to go over today, and that is a COVID funding summary, and I'll give just a minute for that to be pulled up on the screen.
Laurel, this is Commissioner Hasbrook. Can I ask you a question on page 3?
Yes, go ahead, Madam Chair.
You mentioned something about the funds that were different because of the new formula. Is that the formula that comes from the trustees? I'm trying to figure out why that happened.
That formula change happened from our finance department, I believe, on the advice of their financial officers working group, but Michelle Hanrahan is on the line and can provide more detail on how that formula changed. She's available.
Michelle, are you there?
Yes, I am here. Thank you, Madam Chair. The formula on page 3 is was just to reflect, I'm trying to get to that page, sorry. The treasurer, the state treasurer accounts. So it wasn't related to the trustee.
Okay, that's what I need to know, if our formula is working that we have, because I'm sure that's gonna be coming up here probably this next year on changing that formula again. I think this is year we have to talk about it. Just wanted to make sure that that was not the formula you were saying or you were talking about. So thank you.
Sure.
Thank you, Michelle.
Madam Chair, this is Jane. I had a quick question.
Yes, Jane, go ahead.
For Laurel, I wondered what % decrease in revenue did you see due to COVID and decreasing services?
I did not look at a percent revenue exactly due to the COVID changes in service, but I can get that number and provide it to you. I don't have it available right now.
That would be awesome.
Yep.
Thank you.
No problem.
Okay, any further comments you have, Laurel, or from the board? Any questions or discussion items for Laurel? Well, hearing none, I thank you for your information, Laurel, and we will move on with our agenda to a review of our COVID-19 status by Kim Link, our Communicable Disease Control Manager. Good morning,
Madam Chair,
Kim.
if I may, sorry to interrupt. There is actually one more page. It's a separate report, different from what we normally share. So I think if you don't mind,
Oh, yes.
I'll
Yes,
go over this.
please, go ahead.
Thank
Please
you
go
very
ahead.
much. Again, apologize for the interruption. So this is a new report. This is a COVID funding summary. I just thought it might be of interest, and on the advice of Russ, put this together with the finance team to look at our funding sources, mostly federal sources here, all except one are federal sources. That the Pacific Source grant is local or is a health insurance company, but other than that, it's all federal funding. And this shows what funding's been available, what we've charged to the various contracts that we've had for COVID funding, and then what our remaining balance is. And thought it was important to show this, just to show our financial solvency with the CARES Act funding that came to an end on December 30th. Anticipated that there might be some question as to how we are going to continue funding our COVID response efforts. And as you can see from this report, we have plenty of funds left available to continue funding the response. And if this report is of value or benefit, I'd be happy to continue providing an update on it at the board meetings. I'll stand for any questions on this report as well.
Madam Chair, this is El.
Yes, El, go ahead.
So Laura, it looks like we have, and it's gone now, I can't get it exactly, but about $4 million left to get us through this summer. Are you feeling like that's going to be enough?
Yes, we are anticipating that that will be enough. And there have also been more funding sources announced just over the past week or two. So that $4 million is what we have available now, but we anticipate that it'll be significantly more that we'll have access to in the coming months as well. So not a limit of that, but that's the available balance at this moment in time.
Thank you.
Mm-hmm.
Madam Chair, this is Jane. I had a question.
Yes, Jane, go ahead.
Laurel, did we get any HHS funding?
I don't know the answer to that either. Michelle, are you still available to answer questions?
Yes, Madam Chair, this is Michelle. No, we don't get any funding directly from HHS.
But we bill Medicare and Medicaid, right?
We do, but not, excuse me, not for COVID related expenditures.
No, just regular charges though, correct?
Yes, yes, we do.
Okay.
Yes.
Thank you.
Uh-huh.
Laurel, any further comments or from the board? Any questions for Laurel? Okay, now hearing none, we will move ahead with Kim's report. Kim, go ahead. The floor is yours.
All right, thank you. Good morning.
Good morning.
And Dustin, can
Good
you
morning.
pull up my slide deck? So I'm going to provide an epidemiology update, and it looks like I may have some video issues on my side of things. If that happens, I'll turn off my video. So COVID epi update, it's been a little while since I've provided information about where we're sitting in terms of our COVID cases. This presentation will be a little bit different than what I've done in past weeks, in past board meetings. There are a number of slides, but I will not spend too much time on any one of them just to keep the meeting going. If you can move to the next slide. So this slide is the Ada County weekly COVID case counts, and what I've done is I've pulled together information for each of our 4 counties. It includes the weekly case count, and data is current up through January 9th, so the end of last week. And you'll also see on this graph that there is a red line that's near the bottom on every graph, and that is the 100 cases per 100,000 population benchmark. And this is, I know we talk about different rates when we're looking at COVID, and it's sometimes hard to get an understanding of what these different rates mean and why we're using them. This rate is one that was chosen by the White House Coronavirus Task Force. They're using it as an indicator of when an area is what they call in the red zone. It's an indicator of when we have markers of widespread community transmission in an area. And it's one that when we're looking at the case numbers, it's a marker that our cases are high enough that contact tracing alone is not going to be sufficient to keep the current outbreak in check, and an indicator that additional community mitigation strategies are warranted. So as we look here at Ada County, you'll see we are, as of last week, we had 1,700 cases reported. We came down quite a bit from where we were sitting at the peak in November and December, had a low point in right around the week of Christmas, but then climbed up again. So unfortunately, it does look like we're potentially starting to climb again. And as of note, when we look at that 100 per 100,000 cases, Ada County has been above that threshold since the 20th of September. Next slide. So this is the Boise County weekly COVID case counts. You can see again, Boise County has a much smaller population, so those numbers that we're seeing reported are proportionally smaller as well. Boise County did go above 100 per 100,000 back at the end of October, stayed there for a number of weeks, and then came down below that marker, came down into single digits for reported cases over the past couple of weeks, and then bumped up again. So still want to keep an eye on where we're sitting with Boise County, but their numbers are much lower than what they were seeing at their peak. Next slide. For Elmore County, again, they experienced a pretty significant peak in their case counts in middle of November, very similar to what we saw in Ada County. They surpassed the 100 per 100,000 population marker again September 20th, same as Ada County, and have stayed above it since then. We did see a significant drop in cases, again, from that peak of 133. Where we're sitting right now is in the 40s. It does look like those numbers may be starting to climb a little bit again, though. But again, still sitting above 100 per 100,000. Next slide. And for Valley County went above the 100 per 100,000 marker on October 25th. Unfortunately, we've been seeing those numbers go up from there. You'll see that there's been a little bit of drops in the numbers, but again, subsequent increases after that. The most recent case count, so for last week, there were 61 cases that were reported out of Valley County. And with the smaller population in the county, that actually puts them, the 2-week case rate for Valley County most recently was 67 per 100,000, which is the highest in our 4-county district at this point in time. So unfortunately, we are seeing a lot of activity right now in Valley County, and it would be great to see those numbers come down. Next slide. So this slide is looking at the weekly PCR tests completed and percent positivity. The PCR tests are in the blue bar graph, and then percent positivity is the orange line. And what you'll see is that percent positivity really looks similar to what we're seeing for our case counts. So we had, back in the beginning of September, we were sitting at just below 5%. And when we're looking at percent positivity, staying below 5% is our goal. Unfortunately, we've been above that ever since September, and we peaked out at about 18% positivity. With our case counts coming down, that percent positivity came down to about 10% a couple weeks ago. We saw a slight bump with right around the new year, and then in the most recent week, we came down again. So currently across our district, we're sitting at about 10% positivity. Again, we want that goal to be, or the goal for us is to be below 5%. That's an indicator that we have enough testing going on in the area to really have a good idea of the true amount of illness within our communities. Next slide. So I'm going to shift over into our hospitalization data. This is the Ada County resident COVID non-ICU hospitalizations. This slide includes data going back to the beginning of when we started collecting this, which was at the end of August. So as far as we look at these trend lines, again, very similar to our case counts, where September we saw our low point for hospitalizations, and then that went up. Of course, we were in the situation where our hospitals were seeing significant strain in November and into early December. The number of hospitalizations has come down quite a bit. So again, this is non-ICU Ada County residents. We're currently sitting at about 50 Ada County residents who are hospitalized for COVID, not in the ICU at this point in time. Next slide. So this is the Ada County resident ICU hospitalizations due to COVID. Again, similar trajectory. You'll see there is a bit more variability in this graph. And again, part of that is because we're looking at smaller numbers. So I talked about that there are currently 50 Ada County residents receiving hospital care not in the ICU. We currently have 12 Ada County residents who are in ICU care at this time. So we saw that the numbers went up. We peaked at nearly 20, and we have gone down from there. Again, not as much of a decline as what we saw within those non-ICU hospitalizations. And next slide. So as we look at our hospitalizations, again, as we've done traditionally, looking at what's going on with the Ada County residents, but then also looking at what's going on with our Ada County hospitals. So this slide is the total non-ICU census within our Ada County hospitals. And again, very similar trajectory to what we saw with Ada County residents, where we had our lowest points were in September. We had that significant increase as a result of our statewide surge in cases, peaked out in December, and then those numbers have come down again. So as we're sitting right now, just looking at this graph, we're just above 70 people total hospitalized in Ada County as a result of COVID in non-ICU care. Next slide. So this is looking at our Ada County hospitals, and this is the ICU census. So what you'll see here, again, similar trajectory, a little bit more variability in terms of the high and low points. But unfortunately, we are not seeing the same type of decline in ICU beds or ICU patients as we have with total COVID. So it looks like we are maybe again on a little bit of an upswing in terms of the number of people in ICU care. We are sitting at about 30 people in total receiving ICU care as a result of COVID right now. And that is almost a third of our total ICU bed availability for Ada County. So still seeing that our ICUs are taking on a sizable burden in terms of what we're, in terms of COVID. Next slide. So I wanted to include in a little bit of information just looking at Ada County resident case counts and hospitalizations. So when we talk about our hospitalizations, and I've brought this up before, we know that there is going to be a lag time between when we see an increase in the number of cases and those subsequent hospitalizations. And so this graph that we have here is looking at the case counts, which is the blue dashed line. It corresponds to the y-axis that's on the left-hand side, and then the hospitalizations for Ada County residents is on the orange line, and that y-axis is on the right-hand side. Of course, we're looking at very different total numbers, but the thing that I want to point out here is that you can see that our hospitalizations really are tracking with our case counts as far as seeing the increases over time. And you can really see that delay that we were talking about. So at some points, it looks like probably a week to potentially a week and a half in terms of those differences in trends. And I think that, as we look at these as this relationship, it's important to remember that moving forward. So next slide. So this slide titled Hospitalizations are impacted by more than the prior week's case count. And what I want to point out here is, of course, as we look at how our numbers are changing, those are going to be impacting our hospitalizations. But the relationship between them isn't as simple as saying that if we have 1,000 cases on this week, we are going to have X number of hospitalizations the next week. As we look at our total hospitalizations, they really are being impacted not only by what's going on the week prior, but really what's been going on within our community over the last month to potentially even upwards of 6 weeks period of time. So how many total cumulative cases have we had? And as we look at our data, this a great example happened most recently. So as we look at the text box on the bottom, looking at 2 weeks where we have very similar cases, week of 10/18, we have 1,154 cases reported among Ada County residents. Week of 12/20, so just a couple weeks ago, we had 1,141 cases. Very similar weeks in terms of total case counts. However, you'll see that the hospitalizations that occurred a week after that were much different between those 2 weeks. So week of 10/25, we saw 32 hospitalizations, and then the week of 12/27, we saw on average 63 hospitalizations. And again, this has to do with the fact that if you look at the say 4 weeks prior, what we see is a very different picture. So during the week of 10/25, we were just starting to get into that surge. There wasn't a large cumulative burden of illness within our community. Week of 12/27 was a very different picture. We were just starting to come off of the 3,000 case weeks. And the reason I bring this up is because it looks like our case numbers may be climbing again. And I think that it is potentially an easy thing to say that, oh, hey, we had 3,000 case weeks. Our hospitalizations our hospitals were strained, but they didn't go into crisis standards of care. So that means that we can handle 3,000 case weeks. Well, that may not be the case. I think what we will see is if our case counts again increase, especially if they increase rapidly, our hospitalizations are going to increase at a faster pace than what we saw before. And there's a potential that we'll see higher numbers of hospitalizations and see more strain on the medical community than what we did during the last surge. So I just want to make sure that this board keeps that in mind as we look at decision making, that we need to look at what's going on in the overall picture of case counts and burden of illness as well. Next slide. So I did want to include a little bit of information about surveillance that's going on for that British strain, or the highly transmissible variant of COVID-19. I've received a number of questions about it, so I thought it would be good to include some information about it. There are a number of laboratories here locally who they're not able to directly detect that strain of the virus, but they perform a PCR method that can detect, I guess I would say, a signature that is suspicious for this virus. So if they find a virus that is, coming from a specimen, it looks suspicious, what they're doing is they're forwarding on to other labs who are able to do the genotyping and say definitively yes or no if it's this British strain. So at this point in time, we haven't had any specimens that have tested positive for this specific strain. I think that if we were to have that happen, I know here in Health District 4, I would definitely advocate for making sure that it was made aware to the general public, and I anticipate that would be the same if it was coming out of any other health district as well. So I just wanted to include that information so that everybody is aware that there is surveillance going on for this particular strain, and if we do find it, when we do find it, unfortunately, just the way that COVID works, by the time that it's detected, it will probably be a couple of weeks out from when that original person became ill as a result of the virus. So our efforts for contact tracing and really clamping down on the spread of it may be a bit challenging just because we might be a couple of generations into transmission of it. So if it passes from person to person every 3 to 5 days, say it takes 2 weeks to detect it, we would be a few generations down the line of transmission. But we do have that ability, and in public health, we would do everything that we can to try to prevent further transmission of the virus. So in summary, as we're looking at what's going on right now across our 4 counties, in Ada County, our case numbers definitely have come down. Our hospitalizations have come down in a similar trend. Our hospitals are no longer in the position of having to look at imminently implementing crisis standards of care, but we do still have high case numbers. Our situation could definitely move back into what we were seeing in November and December. We're getting vaccine out into the community, but we're in a position that vaccine is not going to be providing that community level protection that we need for a while still. So we are going to need to rely on the public to continue doing all of those things that we're asking of them in terms of masking, physical distancing, and limiting social gatherings. And with all of those things in place, we hopefully will find ourselves in a position that we can keep the case numbers in check and keep things low enough that we are able to see, the results of vaccine. The other area that I want to point out again is looking at Valley County. So as I pointed out, our 2-week case rate for Valley County right now is the highest of our 4 counties. And those case numbers are definitely concerning. I think we have some really good things in place in Valley County. We have health district order in place. We have the public health advisory. We have, I know the city of McCall has done a resolution in terms of providing recommendations as far as what people need to be doing. And I think it is going to be really important for residents of Valley County, again, to be doing all those things that we're asking. So the masking, physical distancing, limiting social gatherings. And the other thing that's going to be important is that people who are traveling to Valley County for either going to a second home or for the purposes of recreation are doing the same as well, so that we can keep those case numbers in check and hopefully start getting them to drop some. With that, that's the end of my presentation. I'm happy to take questions.
Thank you, Kim. The floor is open for questions for Kim.
Madam Chair, this is El.
Yes, go ahead, Elt.
Kim, 2 questions. If we get the British strain of this virus, does that trace back and that follow up and that kind of take precedence over the regular strain? And then the second question is, from what I've read, the vaccinations will still handle this new strain. Is that correct?
So, Madam Chair, Commissioner Hasbrook, I'll start with the second question first. And yes, all evidence shows that the vaccine does cover against that strain. And in terms of what we would look at for contact tracing, we would prioritize. As I said, unfortunately, just due to the timing of things, when we look at that source individual, we would have to quickly look a couple of rounds out from that person. So not only who were their contacts, but then the contacts of their contacts, and potentially even one more level out from that. So yeah, I think that if it or when that virus strain is detected here, it is going to be challenging to keep it in check. The thing to know about it, though, is that it does not appear to cause more serious illness. It's just a matter that it's easier to become infected with it.
Thank you.
Madam Chair, this is Jane.
Yes, Jane, go ahead.
I just wanted to thank Kim for the look back portion of that to understand the differences between the rates that we were seeing in the hospitalizations. That really meant a lot to help understand that. Thank you.
Thank you.
Any further questions for Kim? Well, Kim, hearing none, I thank you very much for your information today, and hopefully our situation will improve in all of our 4 counties, particularly Valley County and Ada County at this time. So proceeding on with our agenda, we will go to a review of vaccine status and distribution plan by Natalie Bodine, our Public Health Preparedness Program Manager. Natalie, the floor is yours.
Thank you, Madam Chair, and good morning to our Board of Health members. We're going to just jump right into it, and thank you again for the time to give a vaccine brief, taking a look at our planning and allocation activities for Central District Health. So what you're seeing here is a weekly allocation chart that we've been keeping track since we first started receiving vaccines into the state and then into our district. So actually starting on December 14th, which we consider week 1, you can see the breakout of the number of Pfizer doses that we received for allocation and the number of Moderna doses that we received for allocation in that particular week. And then also identifying the priority population and the phases following the CDC ACIP guidance, as well as our governor's coronavirus vaccine advisory committee guidance. And the priority populations, you see those phases. I have a few more slides that follow that we can dive into a little bit more detail as to what those phases 1.1 and then moving into 2.1 look like and what those subgroups look like. So just to review the process as to how allocation is currently happening right now in the state and in the districts is typically by Thursday morning every week, we get an email from the Idaho Immunization Program outlining how many doses of what type of vaccine that we have available in our district to allocate to those vaccinating providers that have been approved through the Idaho Immunization Program. So we get these numbers on Thursday, and then given the information and communication that we have regularly with those vaccinating providers, talking about uptake, capability, any kind of challenges, we will meet with our internal vaccine planning group and come up with an allocation plan. So we will decide how many doses will go to what particular vaccinating providers, and of course what priority population we're going to continue to focus on. So that happens on Thursdays. We get those numbers, we come up with our allocation plan, and then we provide that back to the Idaho Immunization Program, who then puts in the order with CDC, and those vaccines are actually delivered the following week. So when you look at week 6, if I can jump ahead, Thursday morning, we received our dose allocation numbers. We will be receiving 6 trays of the Pfizer vaccine. Each tray of Pfizer has 975 doses, and we are receiving 1,500 doses of Moderna. So we will be working on our allocation plan this afternoon with our internal vaccine planning group. And then we'll put that order in over the weekend, and the delivery of those vaccines will happen next Tuesday, is what we're being told for delivery to those providers. So that is the process. You can see the total number we're in week 6 now. Next week is considered really week 6 for the total number of Pfizer doses and total number of Moderna doses that we have with us. So the asterisk note on here also wanted to talk about the number of vaccinating providers that we have enrolled in our jurisdiction. So providers that are interested in receiving, storing, and administering COVID vaccine need to sign up and go through an application process through the Idaho Immunization Program, and it's actually an agreement with the federal government to be a vaccinating provider. So we get a daily list from the Idaho Immunization Program, a daily update. And so actually I looked this morning and it looks like we had 3 additional providers that were approved. So currently we are sitting at 65 enrolled provider locations with 19 pending approval within our jurisdiction. And I say provider locations because we have a number of providers that have multiple locations, multiple clinic sites that have been approved to receive and administer vaccine from. So for example, St. Luke's Health System has 7 different clinic sites that have been approved to receive and administer vaccine. Primary Health Medical Group has 15. Family Medicine Health Center has 6. Albertsons Save-On Pharmacies has a number of locations as well. And then the pending approval. So most often, if a provider has enrolled, if they are still sitting in pending status, the state is typically working with them to ensure that they have the proper storage capability to receive and store the type of vaccine that they're going to be getting. So we, like I said, we do have 19 providers that are sitting in pending status right now. And next slide, please. So this is the updated vaccine prioritization schedule that is developed and put out by the Idaho Department of Health and Welfare. So on Tuesday of this week, Governor Little did approve the CVAC, so the Coronavirus Vaccine Advisory Committee that he put together. He did approve their recommendations to move certain subgroups within phase 2 up, and we'll see that slide here in just a little bit. So this is a current schedule for vaccine prioritization looking at, and this is currently looking at phase 1. So phase 1 has 2 groups. It has healthcare personnel and long-term care facilities. So within healthcare personnel group 1, there are 7 different subgroups. So of course, this is what we started with when we first were receiving vaccine. Started at the top and working our way through these particular subgroups and our vaccinating providers. Next slide, please. So I would say that we are still working with, we have cleared our list pretty well in providing and connecting those priority subgroups to a vaccinating provider. We're still pushing through and receiving calls from, into subgroups 1.6, 1.7. So we are still working through phase 1, but we are certainly making our way through that phase 1 pretty quickly, I think, if we've only been really vaccinating for about 4 weeks now. And then long-term care facility residents, so I think I spoke last time that there's a couple different avenues that our long-term cares have been receiving vaccine. So the first one is through the National Pharmacy Partnership Program. And this was a program with the federal government, with CVS and Walgreens pharmacies, that long-term care facilities could sign up with them to get direct vaccinations from CVS and Walgreens. That program has been activated, and they have been vaccinating now in those facilities that signed up for a few weeks, and they're hoping to complete their list by the end of January. So not every long-term care facility did sign up with CVS and Walgreens, so we have been working through a group of those facilities, ensuring that they're connected to a vaccinating provider. So we did have a list and have been reaching out and working with them to make sure that their staff and residents were also taken care of and didn't fall through the cracks. So I think we're getting pretty close to meeting that need and getting all those facilities vaccinated. So that's going very well. Next slide. So these are some of the major changes. So this is looking at phase 2, which is essential workers and adults 65 years of age and older. So again, with the Governor Little's announcement on Tuesday that we would be moving into phase 2 this month, and then actually moving into those subgroups 2.1 as of this week. So we kind of, hit the gas pedal to start to move into those 2.1 subgroups. And of course, our vaccinating providers also did the same. St. Luke's, St. Al's, Primary Health, and some other vaccinating providers have opened up outpatient clinics to start to serve those subgroups that are now in phase 2. So you can, I believe, on the next slide. So this is the continuation of phase 2, and you'll see that the adults 65 years of age and older were moved up in phase 2. So they will actually begin from what the governor had outlined on his timeline starting February 1st, that will open up to that subgroup on February 1st. Next slide. So this is another graphic that the Idaho Department of Health and Welfare developed a few weeks ago and put out. It has since been updated since Governor Little's address on Tuesday to show the current updates in that phase 2 under frontline essential workers and adults 65 years of age and older. So here I noted earlier, starting on January 12th, these are these phase 2, subgroup 1. So you're looking at first responders, firefighters, law enforcement, protective services. We're looking at our schools, so pre-K and childcare and daycare workers, and then our correctional and detention facility staff, other than their medical personnel, which correctional facility medical personnel were vaccinated and prioritized in phase 1. So we have adjusted to start to work towards the governor's recommendations and the new priority groups that he has outlined for us. And then you can see from my first slide that I put out, the demand for vaccine is still far greater than our supply. The federal government did announce that they are going to be releasing all second doses that have been held back. So we are anticipating and hopeful that within just a couple weeks' time, we'll begin to see hopefully a pretty significant surge in the amount of vaccine and doses that are allocated to our state, which will then be allocated to our district. So we are slowly starting to creep up every week, but our dose allocation numbers are still pretty low. So doing the best we can. There are a lot of providers out there that are ready to go. And we're just waiting for that vaccine supply to open up. So with that, I will end my presentation. And if there are any questions, I'll do my best to answer. And there are a couple others that are part of our internal vaccine group that I would welcome to jump in, like Russ and Laurel. It's a team effort for sure on our vaccine allocation and distribution. So thank you, Madam Chair.
Thank you, Natalie. The floor is open for questions for Natalie or discussion points.
Madam Chair, this is Representative Blanksmith.
Yes, Megan, go ahead.
Just a quick question for Natalie, just for clarification. If I look at the last page starting February 21, just to be clear, it's not food and agriculture workers that are older than 65, it's 65 and older, and I just wanted clarification on that, please.
Yeah, Madam Chair, this is Natalie.
Yes, Natalie, go ahead.
Yes, you're correct. So starting February 2021, those are specific subgroups. So it'll be the population of adults 65 years of age and older, and then also looking into food and agriculture workers, manufacturing workers, and beyond. So that is a separate subgroup.
Any further questions for Natalie? Well, Natalie, thank you so much for that presentation. It sounds like you certainly have your challenges, and we're grateful to have such a team as yours working on this. With that, I will proceed with our agenda, and we will be provided with an update for our Public Health District Executive Council by Commissioner Hasbrook. So, Elk, go ahead.
We had a call here last week and we all kind of agreed. Well, let me kind of go back and start over again. We've had 2 replacements on the executive council. Tom Dale, I think, retired as a commissioner, and there's a new person that we haven't met. We'll meet today that's taken over that trustee position. And shoot, now I can't think of the guy from Lewiston. He retired out, and Greg from Clearwater County is going to be the trustee from that district. Doug Zenner was the one that retired. So we got some new faces on the executive council. We met last week and we were kind of concerned about what the legislature might do to us. So we all agreed to fund a lobbyist in the tune of about $5,000 a month for 3 months. Mike Kane is going to be our lobbyist to kind of protect us in the legislature this year. And we're going to have another call right after this meeting at 10 to kind of get an update on that. And other than that, because we didn't have a big IAB conference this year, we had the funds already available. So we decided to go ahead and use those funds to pay for the lobbyists. And the only other thing that we paid for was that one of the districts hired an attorney to do investigation on whether or not we could use public funds to hire lobbyists, and that came back as good news. And there was a $325 bill or $28 bill that we agreed to share that expense as well. Other than that, that's kind of where we are right now. Any questions? I will let you guys know if we hear anything bad coming from that darn legislature. Who knows?
Okay, thank you, El. Russ, I'm going to turn back to you for the Director District Report at this time.
Sure, thank you, Madam Chair. Just a few comments. First, I wanted to talk about the Ada County appointment. So Ada County Board of Commissioners appointed Mr. Raul Labrador to replace Diana Laciando on the Board of Health. Ms. Laciando resigned from the board effective Friday, January 8th. Mr. Labrador's appointment must be confirmed by the majority of commissioners within the public health district. So ballots have been sent to the commissioners of Valley, Elmore, and Boise counties, and their vote should come back to CDH in the next week or 2. I just want to point out, I know there was a fair number of public comments that came in that were shared with the board regarding this appointment. And for the public's benefit, it's not this board's decision to make. It's the decision of the 12 county commissioners of the 4 counties we serve. As was shared with you by Natalie Bodine, CDH has added vaccine distribution and management to our pandemic response. Everything else that we were doing does not go away. This is just an additional responsibility that we definitely have planned for. We have a lot of vaccine providers out in our community that are ready, willing, and very capable of administering the vaccine. I don't have any concerns about our health district's ability to get the vaccines administered. We just need the vaccine. I also want to emphasize that while our community is being vaccinated, we're still in the very early stages. As Kimberly Link shared, we were seeing a significant number of cases being reported, and the volume of COVID patients in our hospitals remain very high. And she kind of walked through that chart, I think, that was really helpful to demonstrate that even when the cases are lower, it doesn't necessarily mean the hospitalizations drop proportionally, and that clearly would be a big concern if we see continued rise in cases that we're seeing right now. So to repeat her message, please continue to wear your mask when you're around others, physically distance, avoid gatherings, wash your hands frequently, and definitely stay home if you're sick. The next scheduled meeting of the CDH Board of Health is on Friday, February 14th. The meeting will start at 8:30. We're going to continue to have virtual meetings planned for the remainder of the calendar year, but that certainly could change if our situation changes with COVID. We do have limited seating available for the public to observe here in the room that Representative Blanksma and I are in right now. The meeting will be broadcast on our YouTube channel live, and then we post the meetings subsequent on our website if somebody would like to view them later on. So that's all I have, and be glad to answer any questions from the board.
Russ, this is Betty Ann. Would you repeat the date of that meeting? What I heard was February 14th from you. Now, I don't know if I have February 19th down.
Madam Chair, I do see that on the schedule that it's February 19th. Let me confirm that. You're correct. It is February 19th. Thanks for the correction.
Okay, thank you.
Madam Chair, this is El.
Yes, El, go ahead.
Russ, can you explain to us on the vote for the Yeti County appointment? I'm assuming there's 12 commissioners, so he's going to need at least 7 votes. Is that correct? And the second question is, if we don't vote for him, that's I'm assuming a no vote?
Madam Chair, it's Russ.
Yes, Russ, go ahead.
That you're correct, Commissioner Hasbrook. There's 12 commissioners, so 7 votes would allow him to be appointed. As far as the not voting, I think it would just come down to those who do actually vote. So if 7 people vote and 7 commissioners vote and 4 are in support, then he would be approved to be a Board of Health member.
Well, then if we are not in support of this, do we just vote no on the ballot?
Madam Chair, it's Russ.
Yes, Russ, go ahead.
That would be correct. Any commissioner that votes to support this appointment would vote yes, and if you don't support the appointment, vote no, and send those back to CDH, and we'll make sure we inform Ada County once we receive all the votes.
Thank you. I appreciate that.
Sure.
Madam Chair, can I make a comment, please? It's Megan.
Yes, Megan, go ahead.
Thank you. I would like to remind everybody on the board that counties feel a little bit of an autonomy, and everybody's vote is their own, but if you want to go down the road of telling other counties who should represent them, that strikes me as a little rough. I also, if anybody would like to talk to Mr. Labrador, I do have his number, and I'm sure he'd be happy to speak with you if you wanted to talk with him.
Okay, thank you, Megan. Any further items of discussion before we adjourn? Well, hearing none, I thank everybody for their attendance and participation today, and I will call for a motion for adjournment at this time.
Madam Chair, this is Commissioner Sturm. I'll motion for adjournment.
I'll second.
Okay, thank you, Ryan. That was Megan for second, correct?
Correct.
Is that correct? Okay. Okay, I will call for a vote on the motion for adjournment, starting with Ada County. Dr. Young?
Jane Young, aye.
Okay, thank you, Jane. Dr. Epperly? I don't believe Ted's on the call. Boise County?
Commissioner Sturm, aye.
Elmore County?
Representative Blanksma, aye.
Valley County?
Commissioner Hasbrook, aye.
Okay, thank you. The motion for adjournment passes. And once again, I thank everybody for their attendance and participation this morning, and have a wonderful day. Goodbye.
Have a good day, everyone.